In this video, we're going to cover key things that I think you need to know about varicose veins, which are swollen and enlarged veins that usually occur on the legs and feet. They may be blue or dark purple in colour, and they're often lumpy, bulging or twisted in appearance. In this video, we're going to cover causes, symptoms and treatment, plus tips on when you should go and see your doctor. So first of all, let's discuss causes of varicose veins. Well, varicose veins develop when the small valves that are inside veins stop working properly. In a healthy vein, blood flows smoothly to the heart. The blood is prevented from flowing backwards by a series of tiny valves that open and close to let blood through. However, if the valves weaken or they're damaged, the blood can flow backwards in the vein and collect, eventually causing it to be swollen and enlarged, and the medical term for this is varicose. Now, without getting too technical, there are different types of varicose veins, and we'll briefly discuss 3 of them now. The first are trunk varicose veins. These are near to the surface of the skin, and they're thick and knobbly, and they're often long and can look unpleasant. Second are reticular varicose veins. These are sometimes grouped close together in a network. And thirdly, telangiectasia varicose veins, also known as thread veins or spider veins, and these are small clusters of blue or red veins that sometimes appear on your face or legs. But they're harmless, and unlike trunk varicose veins, they don't tend to bulge underneath the surface of the skin. So what makes you more likely to develop varicose veins? Well, certain things can increase your chances of developing varicose veins. You may be more likely to develop them if you're female, and research suggests this might be because female hormones tend to relax the walls of veins, making the valves more prone to leaking. You may also be more likely to develop them if you've got a close family member with varicose veins, you're older, and that's because your veins start to lose their elasticity or stretchiness, and the valves inside them stop working as well, if you're overweight, if you've got a job that involves long periods of standing, or if you're pregnant. So now we know a little bit more about what they are and some potential causes. Well, what might the signs and symptoms be? Well, the most obvious thing is looking at your legs or feet and seeing them. Other symptoms can include aching, heavy and uncomfortable legs, swollen feet and ankles, burning or throbbing in your legs, as well as cramps or dry, itchy and thin skin over the affected vein. However, other things can cause these symptoms, and if you do have any of them and they're concerning you, see your doctor. Symptoms are usually worse during warm weather or if you've been standing up for long periods of time, and they may improve when you walk around or you rest and raise your legs. Now, in terms of treating varicose veins, well, if treatment is necessary, your doctor may first recommend using compression stockings, taking regular exercise and elevating the affected area when resting. If your varicose veins are still causing you pain and discomfort, even after doing these things, or they cause complications, they can be treated in several ways. Now, one option is something called endothermal ablation. This is where heat is used to seal affected veins. Another option is sclerotherapy. This uses special foam to close the veins. And thirdly, something called ligation and stripping. The affected veins are surgically removed. Now, it's unlikely in the UK that you'll receive treatment on the NHS for cosmetic reasons. You're going to have to pay for cosmetic treatment privately, but if you do feel that you require treatment, it might help for you to print out treatment options for varicose veins to discuss them with your doctor. So now we've covered some common treatment options. Well, what about preventing varicose veins? Well, there's actually very little evidence to suggest that you can stop varicose veins from getting worse or completely stop new ones developing. But there are ways to try and ease symptoms of existing varicose veins, and these include avoiding standing or sitting still for long periods and trying to move around every 30 minutes, taking regular breaks throughout the day, raising the legs on pillows whilst resting to try and ease discomfort, and thirdly, exercising regularly. This can both improve circulation as well as help you to maintain a healthy weight. Finally, when should you see your doctor? Well, if you've got varicose veins and they don't cause you any discomfort, you may not need to see your doctor, and that's because varicose veins are rarely a serious condition and they don't usually require treatment. However, you should consider seeing your doctor if your varicose veins are causing you pain or discomfort, the skin over your veins is sore and irritated, or the aching in your legs is causing irritation at night and disturbing your sleep. You should also see your doctor if you've got any concerns personally about these, because obviously this is just a general educational video and not a clinical advice video. Normally your doctor is going to be able to diagnose varicose veins based on the symptoms you have and just by looking at them, although sometimes further tests might be carried out and they may refer you to a specialist in the hospital. I hope you found the video useful and informative. For more information on varicose veins, please do check out the links in the description box of this video. And if you've got any questions, please post them in the comments section below and I will try my best to get back to you. Thanks once again for watching, and until next time, bye.